Good morning and welcome to the Great Lakes Health and Wellness Program with Kaleida Health on the legendary Power 96.5. I'm your host, Francesca Messiah from Kaleida Health. And at Kaleida, we're concerned about your health, that of your neighbors, your extended family, and everyone in the community, and especially during the COVID-19 pandemic. Kaleida continues enhancing the health of our community. If you're interested, if your church, if your school, your PTA, PTO, your business, if you're interested in having a in-person or virtual presentation about COVID-19, but not only COVID, if you're interested in having a physician or a nurse or one of our many professionals come and speak with your group about children's health, behavioral health, mother's health, pregnancy, any topic in the field of healthcare, we would enjoy to prepare a presentation with question and answers to your group. If this is something you'd like to do, please call 863-8717, 863-8717, or email fmessiah, MESIAH, at KaleidaHealth.org. Oh, another important topic I forgot to mention that people are always asking about is nutrition and diabetes and stroke. We have speakers that can come in person or do a virtual presentation before your group. I also want to make you aware that our laboratory department at Kaleida Health, we have presentations targeting high schoolers on careers in science. So if you would like to schedule a virtual or in-person presentation for your high school students, your school or church, again, please call 863-8717 or email fmessiah, MESIAH, at Kaleida Health, KaleidaHealth.org. Kaleida Health is also hiring. There are several positions. They're hiring for everything from environmental to food service to RNs, LPNs, CNAs. Please be sure to check out our website. And Kaleida Health, in case you weren't aware, we are the area's largest healthcare provider with state-of-the-art technology. Kaleida facilities include Buffalo General Medical Center, Gates Vascular Institute, Millard Fillmore Suburban Hospital, John R. Oshai Children's Hospital, Great Lakes Cancer Collaborative, Visiting Nursing Association, 2 long-term care facilities, and several adult and children pediatric clinics, as well as women's clinics located throughout Western New York. And all of our sites are accredited by the DNV. And also we take COVID precautions seriously. We follow the CDC, Center for Disease Control, and New York State standards for all of our sites. Well, on with their show. Our guest for today, what time is it? It's time for students to begin to returning to school. So on that note, our guest for today is Dr. Dennis Kuo. How are you, Dr. Kuo?
I'm doing great. How are you today?
Oh, just fine. And I just want to give a little bit of background about Dr. Kuo. He is the medical director of pediatric primary care services at the John R. Oshai Children's Hospital, our Kaleida's Children's Hospital. And he's the division chief of general pediatrics at UBMD Pediatrics and the University of Buffalo. He received his medical degree from the University of Pennsylvania and his fellowship with Johns Hopkins University. Well, Dr. Kuo, again, thank you for taking time from your hectic schedule to share with our listeners information on children and COVID. And you know what? And on that note, let me just start with the first question. What are the safety precautions parents or caregivers should take when sending their children to school? And what should they carry in their backpack?
Yeah. So the AAP, the American Academy of Pediatrics, and its Centers for Disease Control have entered, have really given us very, very comprehensive, excellent guidelines that schools and families should be following for this coming year. We all strongly recommend that kids 2 and up wear masks. We know that they prevent the transmission of COVID. We know that they are essential to keeping the schools open and for children and their teachers and staff to be healthy in school. We recommend that the parents know and understand the guidance that may be at the school and county level that they need to be following. More than anything else, in addition to the masks, they need to make sure that if their child is sick, that they need to stay at home. Those guidances, along with making sure that the kids are following all of the distancing and flow guidance that the schools and the county are providing, will ensure that kids have a safe year at school.
And something you just mentioned if the child is sick or you think they have a cold or which could be COVID, to stay at home. Now, if they're staying at home and there are other family members, should everyone then need to wear a mask?
At this point, indoor masking is really strongly recommended by the Centers for Disease Control in areas that have either substantial or high transmission. Whether a family chooses to wear masks is in their own household is certainly a personal decision, given the cohorting and the sharing of germs and and whether individuals are vaccinated in the house. That said, certainly masks are protective. If you have a child or an adult that is symptomatic and potentially have COVID, there are recommendations about quarantining. That said, we always have to balance a child being quarantined with a child not being able to see his or her parents, and that's not something that we really want to do either. So I think parents certainly want to figure it out. You want the kids that are at home, they need to be with their family. It will certainly help if parents are vaccinated and individuals who are 12 and up are vaccinated. And the little kids, we don't think the little kids tend to transmit COVID as well as the older kids, although certainly little kids can transmit COVID. So to the extent that parents can wash their hands, wear masks, but be able to take care and tend to their kids, that's certainly the best way to get through an illness.
Mm-hmm. And they may not carry the COVID germ, but kids can carry other germs. So just so you know that they still carry germs, and it's all about keeping everybody safe, and especially if I know where before when COVID first started, people would always say, and you should quarantine to a separate room. Well, if you don't have another room to quarantine to, I guess that's why I was thinking about everyone maybe for a day or two in the family wearing a mask in case especially if you don't have another area in the house.
So a couple of things to consider. The first is that there are plenty of other viruses that are going around. We saw a virtual standstill of respiratory viruses last year with all the masking and distancing. We really just didn't see kids getting sick. We are seeing those viruses now. We're seeing them in our offices. We're seeing them in the hospitals. Those viruses are also happening off season. We're seeing otherwise typical winter viruses show up during the summer. So we know that things are going around. The old mainstays of washing your hands, covering your mouth when you sneeze or cough. I mean, those all still apply. Nothing changed about that. When we're talking about the transmission of disease, we want households to make sure that you have to look at not only who's in your household, because you may have somebody who is immunocompromised or you may have somebody who is vaccinated, fully vaccinated, hopefully multiple people are fully vaccinated. And that also is something to consider with the transmission of any of these viruses within a household. Certainly, when you have a household where there's one or more, two more members that are sick, it's important for that household to keep their sick kids or adults at home so that it does not spread to other households. But what families do within their own households are things that they have to do what's best for their own families. I certainly would be reluctant to take a 6-year-old and completely isolate them, because a 6-year-old will be scared and need their parent, and you do not want to do that either. But I would look carefully at who's compromised. Certainly staying at home when you are sick does make a difference. Wash your hands, cover your mouth when you cough, cover your mouth when you sneeze. And if you are eligible for the COVID vaccine, get your vaccine.
Yeah. And I guess along that note, it's even either wash your towels or use paper towels to wipe your hands. So because a wet towel could still carry the virus if everyone's using the same towel. So that just kind of popped in my mind.
Yeah, but so we do recommend just standard surface cleaning. Particularly, it's good to make sure that surfaces are wiped down. I don't think we know more now that COVID doesn't tend to transfer around surfaces nearly as readily as we thought it did when, in the early days, because you would hear things about, wipe down your surfaces multiple times a day. COVID doesn't really transmit that way. It transmits on large respiratory drops with close contact. We're not as concerned about the surfaces like we used to. We certainly do say, yes, wash your hands, keep your sanitizer, cover your mouth when you cough or sneeze, but that is really because that's the way you prevent respiratory droplets from passing through the air. We're not really as concerned as we used to be about the surfaces.
Well, that's good news. That's great news. How about in the backpacks? I know there are a lot of backpacks giveaways taking place, and I've seen notebooks and things. Do you recommend, if the child can, if the family can, pack an extra mask in their backpack, or if they're old enough, hand sanitizer in the backpack? What are your thoughts on that?
I think those are always good ideas. You never want to be caught in a position where you don't have a mask, where you need to go in with a mask. Without it, you have to go in with a mask. Hand sanitizers, in the early days of the pandemic, the hand sanitizers were very popular to the point where you couldn't find them. They're a lot easier to find now. You just want to be prepared for any situation you go into. So it's always a good idea to have multiple masks on you, just in case you find that you forgot one, and then you've got a mask readily available if you need it, that you may have just stashed in a place that you just find you may need at that time.
How about Niagara Peds? Do they administer COVID vaccine for children?
Niagara Pediatrics and many practices around the county can and do administer COVID vaccines. It is something that you can talk with your doctor about. The county, Erie County, has been really a fantastic partner with the medical community in helping ensure that COVID vaccines are available pretty much everywhere and anywhere. That includes not just the pop-up vaccine clinics and that are all around the county, but also in your doctor's offices. Our thinking is that you want to make sure that you have multiple places where you can get the vaccine, and you want to be getting the vaccine where you're most comfortable with. And we know that a strong relationship and recommendation for a doctor is very much correlated with getting the right care, which includes the COVID vaccine. The COVID vaccine, the storage and handling requirements are quite different than many of the regular vaccines that we would give in childhood. So it is something that I would recommend call your doctor and see what they may have scheduled around giving the COVID vaccine. There's just very specific storage and handling requirements that all the doctor's offices that have the vaccine are used to, but it's a little more difficult than just walking and getting the vaccine. You may have to make sure that there's specific times that they're getting the vaccine, specific days. But yeah, the county has made the vaccine available to many of our practices, so it's worth calling and finding out.
And what if the parent needs a vaccine? Can they make an appointment with their child, or I should say the adult caregiver or the parent? Can they make an appointment with their child and get the vaccine at Niagara Peds, or is it only for children?
So at our practice, it is only for children. As for the other practices, that's something that they would be able to talk with their own doctor. But it's something that I think that it's pretty clear that many of the doctors have been offered the same opportunity from the county. So they should be able to find it at their own doctors. They may be able to find it at their own doctor as well.
Mm-hmm. Now, how about, I mean, I don't know if this is your area, but what happens if the teacher isn't vaccinated? The child's teacher isn't vaccinated. Do you have any thoughts on that?
Whether somebody is vaccinated or not is an individual decision, as well as subject to whatever mandates may have come from organizations or potentially a governing body like the state or the county. So that's not something that I would have specific insight on, especially since they are changing all the time, especially in reaction to the rapidly increasing rates that we're seeing throughout the country and also here in Western New York. I will say this, though. The school guidance is really meant to assume the possibility that individuals will walk into the school with COVID and maybe asymptomatic. Many school districts may be doing screening testing, and certainly we want individuals to stay at home when they are sick with symptoms. But we also know that one of the very, very frustrating issues with COVID is that there is asymptomatic transmission. And so the guidance with masks and distancing are really designed to protect against the possibility that somebody will just walk in with COVID. And in that sense, that as much as we want our everybody who's eligible to be vaccinated, we have a multi-layered process for keeping teachers, staff, students, everybody safe. You can't rely on just one thing. You have to rely on multiple different interventions. Again, all guidance that have been well thought through by the CDC and AAP, which would protect against the possibility that somebody will walk in with asymptomatic COVID.
Now, also just regarding making an appointment with let's say Niagara Peds, is the office open for in-person visits, or are you still doing the telemedicine visits?
Pretty much everybody's open for in-person visits. Niagara Peds, Broadway Pediatrics, our two primary care practices, are very much open for in-person visits. We do still offer telemedicine visits. If there are situations where you may have somebody where there is concern, or you just feel more comfortable, that is something that we offer. Many other practices will offer them as well. It's something you can talk with your doctor. We do recommend, if possible, and if folks feel safe, that you try to do the in-person visit. Every precaution is taken within the practice to make sure that the practice is safe. That includes if you come in and you have symptoms, you need to get into a room right away. Everybody is masked. We have appropriate PPE. We make sure that people are not sitting in one place. You have to make sure that folks are separated so that they are safe in the event that there may be somebody who is carrying it. Because that is always something but that may be the case no matter where you are, whether you're at school, whether you're in a place of business, that is always a possibility. That said, healthcare facilities, including Niagara Pediatrics and Broadway Pediatrics, we are set up to make sure that it is a safe experience, so you can come in and feel that we're safe. Healthcare facilities, at this point, we have really a year and a half experience of keeping the environment safe, and we never stopped.
Mm-hmm. You know what? One important thing I didn't ask: where is Niagara Peds and where is Broadway Peds?
Niagara Pediatrics, one of our primary care practices, is at 1050 Niagara Street. That is on the west side.
Next to that big Tim Hortons, right?
Yes, we're just behind the Tim Hortons. And then Broadway Pediatrics, it is at 1021 Broadway.
And can I say it's almost, I would say the parking lot is across from the Broadway Market. So if you know where the Broadway Market is, there's a bank located at the corner. If you cross the street to the right is Niagara Peds. Also, Kaleida Women's Health Services is also located right there in case. And they used you because is it the office that used to be at the corner of Broadway and Clinton? Is that where it moved to?
Broadway Pediatrics is directly to the east of the Broadway Market.
Yes, exactly. Yes. I think all of our listeners would say that they know what are the symptoms, but what are, and you briefly talked about it, because you said the word symptoms. What are some symptoms that, again, school's getting ready to open? Speaking to someone a few minutes ago, talking about the school bus, it's even more people. What are some of the symptoms that the parent should call their pediatrician if they see the parent or the caregiver sees the child with these symptoms? What should they do?
It's cold symptoms. Earlier in the pandemic with kids, we looked at the possibility that we were seeing more vomiting and diarrhea, but more especially with this Delta variant, we are seeing cold symptoms. One thing I would caution parents is that if you see your child sniffling or coughing, you have to consider the possibility that it's COVID. Every school will want you to get your child tested for COVID before you can bring them back to school. So to make sure that it is not COVID. So it's something that you would want to talk with your doctor about. This is to keep every child safe, to keep the schools operating safely, and is for the protection of your child as well as your child's classmates. We do see parents and really individuals. We start with allergy season, and you want to make sure that it's that it really is not COVID, that it's before you start thinking it's allergies.
Now, I know at CVS you can go and get a COVID test as an adult. Can children go to a CVS and get a COVID test, or do they have to go to the pediatrician?
Generally, you can get COVID tests at pretty much all the places where you can get COVID tests. Pretty much all of these places are comfortable testing children. The Erie County Department of Health will be able to provide also testing sites as well as recommendations on where the testing options are.
And I know for Erie County Department of Health, their website is up and running with all the different sites for Buffalo and throughout Erie County. Dr. Cole, we have about 4 more minutes left. Is there anything you'd like to share that we haven't covered?
Yeah, I think that it is incredibly important that we do everything possible as a community to ensure that our kids are safely in school. I also want to mention specifically that we know that this pandemic has really hit certain communities harder. Communities of color. We are very concerned about making sure that our children with disabilities that may be at higher risk, that they also have the opportunity to be in school, which will take all of us as a community to follow the guidance and the mandates and keep our kids masked, make sure that they understand the distancing protocols to keep your kids at home if they are sick, but to be able to support in-person learning as much as possible. We have had quite a ride over the last 18 months. We know that COVID is not done yet. The COVID is extraordinarily widespread with this Delta variant. And the cases have been increasing in New York State pretty rapidly over the last several weeks. We know what's going on in other parts of the country when they don't have these mandates and guidance. We are committed as a community to making sure that our kids have a safe in-person learning experience in school. we've learned a lot, and we know what it's going to take to keep our kids in school and keep them learning. And I am looking forward to an excellent school year. We want to have our kids 5 days a week, 180 days a year. We want them back in school, and we know how to do it.
We do. And Dr. Ko, I just want to say that I might bring you back again in January so we can compare how the first, but for lack of a better word, first semester has gone with the students, and to hear some more of your words of wisdom on what caregivers and parents can make just to keep their children healthy. Because I'm going to be positive. I'm going to say that the numbers will start going down. So I want to say thank you for being our guest, and I'm going to bring you back in, God be willing, I will be bringing you back early in 2022 so we can have a comparison conversation. How does that sound?
Absolutely, anytime. It is so important, really, for the future and for our kids that we give them a safe in-person experience. And we need to acknowledge that even as the cases come down, we are continuing to deal with the after effects of this pandemic. So it will not be over or slowed down once the infections have gone down again. The work will continue.
And that's one thing you use the word community. So I'm just very glad to hear you say this is the entire Western New York, entire New York State community that this is impacting. So I want to thank you for taking time from your hectic schedule. I know earlier you were part of the press conference with Dr. Gail Burstein, our Erie County, from the Erie County Department of Health. And I just want to say thank you.
Thank you. You have a great day.
Thank you. You as well. Well, in 2 weeks, you will be hearing from another one of our physicians from Kaleida Health talking about COVID and prenatal care. Today, you've heard our Dr. Ko talk about COVID and children and going back to school. Next week, you'll hear from my colleague from ECMC, Cynthia Bass. And in 2 weeks, I'll be with you again. And my name is Francesca Messiah from Kaleida Health, Senior Marketing Associate, Community Relations. Take care, wear your mask, take safety precautions against the COVID pandemic. God bless. Bye-bye.